We really want to focus on range of motion, so getting the 3 movements that your hip typically does following the surgery. So the surgical leg is referenced by the white sock. The first exercise you're going to do is we're just going to go through those 3 ranges of motion. So you can do this with a walker, or you can do this with a cane. You can also do this at the kitchen counter or hanging onto a stair rail. What you're going to do is come forward for direction 1, just as comfortable as you can. We're not forcing anything. Come forward, out to the side, and backwards. Forward, out to the side, and backwards. We're just going in that pain-free range of motion. Especially going backwards, we really don't want to force that. So it's just very small movements. The idea is just getting the joint loosened up. So after you go through those, then where you're standing, you're just going to alternate marching. So we start building some strength and confidence on that surgical leg. Alternating marching, 1 at a time. Trying to shoot between about 15 to 20 repetitions. Okay, so for this exercise, what we're gonna do, you're gonna bend up your good leg. And what you're gonna do is just try to raise your surgical leg up and down. Once you feel that you can do that fairly easily, try to lift it up and hold it. Really squeeze in your quad muscle. Hold for between 3 to 5 seconds and then rest it down. The next one is you're going to bend up that surgical side, still staying with the 90 degrees, so we're not bending it all the way up. You're just bending it a little bit. And what you're going to do is you're going to push your heel down into a couch. Hold for about 5 seconds. You should feel it in your hip muscles, especially in your glutes. So really try to squeeze your glutes. Now your leg is not really moving during this, but you are putting some pressure through it. So you're still keeping this angle, and all you're doing is pushing your leg through so you can feel it in the back of your leg and then in your glutes. Hold for about 5 seconds. Try for about 10 to 12 of those.